Hello, and thank you for joining us. My name is Chetna Cates, and I am the Director of Membership at the Baker Institute. I will give a brief introduction of our speaker, Dr. Kelsey Norman, and will be moderating the Q&A session after her presentation. Please use the Q&A button on the bottom of your screen to ask your questions. Dr. Kelsey Norman is the Kelly Day Fellow for the Middle East at Rice University's Baker Institute for Public Policy and the Director of the Women's Rights, Human Rights, and Refugee Program. Her other interests include comparative political institutions, international relations, immigration, citizenship, gender, and Middle East and North African politics. Her book, Reluctant Reception: Refugees, Migration and Governance in the Middle East and North Africa, is based on 3 years of field work in Egypt, Morocco, and Turkey, and is forthcoming with Cambridge University Press later this year. And I'll pass it over to Dr. Norman now.
Great. So thanks so much for joining us today. I'll be speaking about refugees as well as migration more broadly, the impact that the pandemic is having on these populations, as well as the host countries in which they're situated. So thanks so much for joining us, and I hope that we can also speak in person again at some point, but this is a great substitute in the meantime. So what I'll be speaking about today in about the half hour to come is first I'll talk about some sort of background and definitions, including what are these different populations. So what is a migrant versus a refugee versus an internally displaced person and an asylum seeker. And then we can use that background information as we talk about some of the immediate threats that face migrants and refugees as a result of the pandemic, as well as some of the longer term threats to the institutions that are meant to protect refugees and other groups of people. And then lastly, we'll briefly talk about some policy recommendations that can assist in this time. So first of all, I just want to talk about sort of what are the rights that states have to regulate movement. And we'll contrast that with the rights that individuals have to move across international borders. So according to Article 13 of the Universal Declaration of Human Rights, there is a guaranteed right to individuals to move within the country of a state, right? So with basically guaranteeing the right to internal movement within a country. If you want to pick up and move from Chicago to Houston any given day, you can do that, you have that right. Similarly, there is the right given to citizens to leave any country. So if you're a United States citizen and you want to pick up and travel one day to Paris, you have the right to leave the United States, at least according to international law. The government cannot prevent you from doing that, but it doesn't guarantee you the right to be accepted into France. Similarly, if someone from Guatemala, let's say, wants to come and travel to the United States, they can't just they have the right to leave Guatemala, but they don't necessarily have the right to enter the United States without sort of the pre-approval of that receiving government. So under international law, states cannot control who leaves their countries, but they do have the right to control who enters. And this right is even sort of often more heightened during security situations, including like the pandemic at present. So states have a lot of discretion over who they're allowed to enter their territories. But there are certain rights guaranteed to different types of individuals. The first group that we'll talk about are refugees. So a refugee is someone who is outside his or her country of origin due to a well-founded fear of persecution based on race, religion, nationality, membership of a social group or a particular political group or political opinion, and they're not able to return to their country of origin. And this is a definition that's set forth in the 1951 Refugee Convention, which basically emerged out of the World War II period. So it's, it came from a specific time and place, but it's still the definition that we use internationally. So the first thing you'll notice about this definition is that a refugee is someone who has to have left their country, right? So if someone coming from Syria is escaping violence or escaping the civil war there, and has made it to Turkey or Lebanon or Jordan or a neighboring country, that is the first step in becoming a refugee. So many people aren't even able to sort of complete that first step, in which case they would be considered an internally displaced person, right? Not a refugee. So once you've left your country of origin, then you can, in a neighboring country or a third country, you can apply to become a refugee. So you can go through this process where either the United Nations or the country government in which you've arrived will determine whether you meet these criteria, whether you actually should qualify as a refugee under international law. And we can contrast this slightly with an asylum seeker. So an asylum seeker is also someone who has left his or her country of origin, so they've managed to leave, and they're seeking refugee status. So they haven't been granted that status yet, they haven't been granted asylum, but they're hoping that their circumstances make it so that they will be granted the right to be a refugee. But they haven't had their claims evaluated yet, so we don't know for sure if they'll become a refugee. But states globally have responsibilities to these two categories of people, to refugees and to asylum seekers. And an individual who approaches the territory of a state and says that I want to apply for asylum or I want to apply to become a refugee has to be given access to that territory. And that's not just whether a country has signed the 1951 convention that sets forth these parameters. This is international customary law, so it applies globally. Now, a migrant has sort of become this catch-all term that basically refers to people who do not fit these other two categories. So a migrant is someone who also has left his or her country, an international migrant is someone who has left his or her country of origin, presumably voluntarily, although that's not always true in practice, and they're presumed to be seeking economic opportunities. But again, these categories aren't always quite so black and white as they're made out to be here. Someone who, let's say, has left South Sudan and arrived in a country in North Africa. When they first get there, they might not know that they need to go to apply to the United Nations or to the host country government to determine if they can qualify as an asylum seeker and then eventually become a refugee. And in that interim period, they're just going to be considered a migrant, even if they did leave their country of origin for reasons that would eventually have them qualify as a refugee. So people can kind of float between these categories, and it's not always so black and white. But so with these sort of categories and definitions in mind, we'll use them as we're going forward, talking about the impact of the pandemic. And then in terms of where people are sort of situated globally, I think there's this assumption based on what we see in the news and what we sometimes read in articles, that migration tends to happen from countries of the global south to countries of the global north. So migrants and refugees are arriving, crossing the Mediterranean by boat or crossing the US border with Mexico. In reality, it's almost half of the world's migrants that actually are located in the global south. So south-south migration accounts for almost half of global international migration. So this includes, migrating from a country like Tanzania to a country like Kenya, or you can think of lots of other examples. And it's just over half of the world's migration that occurs from the global south to the global north. So what we more traditionally think of as migration occurring. And then with refugees, you can see in the graph on the right, this is much more pronounced. So 86.3% of the world's refugees are living in countries in the global south. And it's just a small percentage that actually are those traditional images we think of, maybe, boats crossing the Mediterranean or people trying to come across the US border. That accounts for a very small percentage of where refugees actually live. So again, with these sort of demographics and with these definitions in mind, let's turn to talk about the current situation with the coronavirus pandemic. So I'm going to separate this into some of the immediate threats that we can think about in regards to refugees, as well as some of these other categories, and then we'll talk about the longer term threats. The first is just the situations that many refugees and asylum seekers find themselves living in. And I think that there's been a lot of advocacy from refugee rights groups to say that refugees are the most vulnerable population out there right now in regards to the pandemic. In terms of the situations in which they're living, this doesn't necessarily make them more vulnerable than low-income nationals of host states. So in terms of overcrowded conditions, it's only a minority, so about 40% of the world's refugees that live in camp situations. It's 60% of global refugees that live in urban areas of host countries. And in those situations, they're actually probably about as vulnerable as host country nationals. But for those living in camps, the situation is quite dangerous. So, or it has the potential to be quite dangerous. So this is a photo, for example, from Cox's Bazar, which is host to just under 1 million Rohingya refugees in Bangladesh. So as you can see from this photo, this is a very densely populated camp situation. And unfortunately, there's also not going to be a lot of access to things like basic sanitation, even necessarily, running water. So all these types of things we hear about, wash your hands, socially distance, are not necessarily possible in these intensely, densely populated areas. And this isn't just the case for refugees, though. So just outside of these camps in Cox's Bazar, there's at least 400,000 Bangladeshi citizens also living in sort of similarly squalid conditions. So if there were to be an outbreak in this type of camp situation, it could also easily spread to the urban population that's right next door. This is another worrying situation. So this is a photo taken from inside the Turkish border, but looking at one of the internally displaced persons camps housing Syrians in northern Syria in Idlib province. So while there hasn't been a major outbreak yet, you can see just from the density of the situation in which people are living, as well as the fact that many of the medical facilities have been destroyed as a result of ongoing attacks on this province in recent months and years, this would be kind of potentially catastrophic if there were to be a major outbreak. So again, the conditions in which people are living do make them susceptible to a rapid spread of the pandemic. Another thing that that really could potentially affect refugees and asylum seekers, I think potentially more than sort of low-income host state citizens, is the lack of access that many of these individuals face to basic services, especially healthcare services. So in many countries of the global south where refugees and asylum seekers are living, they don't necessarily have access to government-provided healthcare. So usually healthcare is provided by NGOs, international NGOs, including in the photo on the left, Caritas, and in the photo on the right, Médecins Sans Frontières. So these are groups, international organizations that sort of step in to provide services, including healthcare, to refugees and asylum seekers on behalf of the host state. But the problem is that with the current pandemic, these international organizations are having a hard time doing the same kind of service provision, whether it's some of their staff has had to go back to their countries of origin, or because of decreased supply routes of getting healthcare basics, medical supplies, to continue the kind of services that they were able to offer before, which even then were somewhat minimal. Another aspect of this is that many refugees and asylum seekers, especially those that are living in urban populations, so less so than those in camps, are already sort of subject to things like xenophobia or suspicion or discrimination in host states. And so they tend to sort of try to keep a low profile. So getting out information to these individuals is particularly difficult. So getting out, public service announcements about updates about the virus are going to be really difficult at a time when people are already sort of nervous and afraid, and might sort of trying to maintain a low profile. And then thirdly is the fact that in order to be eligible for these sort of NGO provided services, asylum seekers and refugees need to be able to register. So they have to still register either with United Nations or with the host country government, depending on the context. And almost all of these registration services have just temporarily closed down, whether we're talking about in Europe or in other countries of the global south. These organizations have either suspended registration or just don't have the ability to sort of staff offices at the moment. So without being able to register, then individuals, asylum seekers and refugees aren't able to even get sort of the basic services that they might have been able to get previously. So that is a concern that is pretty specific, I think, to refugees and asylum seekers. And then the third immediate threat is that there's been a real sort of closure in terms of humanitarian workers being able to conduct the same services internationally that they were doing before the outbreak. So, as you know, lots of countries around the globe have closed their borders. So they're not able to, international aid workers are not able to do the same sort of activities that they were doing. They're not able to access certain countries, or international organizations have recalled their staff, saying you have to go back home to your country of origin, because it's not clear how long these border closures are going to last. This has also disrupted, not just sort of providing services, but also just getting sort of supplies, medical aid, or even food programs that aren't able to access, that refugees and asylum seekers are no longer able to access, because either the staff isn't there or the supplies isn't there. So there's been a huge disruption to this sort of humanitarian aid model that normally assists refugees and asylum seekers in many countries. And I think that this, while it's an immediate threat, it also has the potential to become sort of a long-term threat, in that the global humanitarian model that supports refugees is very reliant upon donors. So the way it works primarily is that, richer countries, wealthier countries provide financial assistance to the United Nations. There's some private donations too, but it comes mostly from governments. And these countries are struggling, obviously, with the current economic situation. So the UN is going to be underfunded. The UN then funds international NGOs as well as local NGOs to carry out some of this service provision and this basic work. And this is going to be, there's going to be just huge funding shortfalls for the sort of foreseeable future. So that's another major issue. Okay, now I'm going to switch to talk about some of the sort of longer term institutional threats that I foresee. So the first one we'll talk about is that beginning on March 17th, the UNHCR, the United Nations High Commissioner for Refugees, and the International Organization for Migration suspended refugee resettlement. So let me just talk briefly about refugee resettlement. What is refugee resettlement? And then we'll talk about the impact. So refugee resettlement is one of the sort of durable solutions that's put forward by the United Nations as a way to get refugees, supposedly the most vulnerable refugees, from residing in countries where they might not be able to integrate or they might not have good access to services, and resettling them to a country, usually in the global north. So in order to ever become eligible for refugee resettlement, you first, as we said, just to become a refugee, you have to leave your country of origin, right? Which is not necessarily an easy thing to do. You have to arrive in a host country, whether it's regularly or irregularly. And then you have to find out about the UNHCR. So in most countries of the global south, the UN is sort of, or most countries of the global south have sort of given this responsibility to the UN to administer. So you have to approach the UNHCR office and you have to register. So this is your first step towards becoming a refugee. Basically at this point, when you've registered, you've become an asylum seeker. So you're seeking refugee status. And at that point, you're told to come back and you have to wait for your appointment for a refugee status determination appointment. So this is the appointment when they'll ask you all sorts of questions, very invasive questions about your background and your history, why you left your country of origin, were you really under threat there? And the problem is that the gap between the step number 4 and step number 5 can be extremely long. So for example, when I was in Egypt in 2014 doing research for one of my projects, individuals who had registered with the UN were being told to come back in 2019 for their RSD appointment. So that's 5 years of just waiting, hoping that you'll eventually qualify as a refugee and could eventually become eligible for resettlement. So it's no easy task to figure out what to do in those interim 5 years with very little support. If you are found to be a refugee at your RSD interview, you will then become potentially eligible for resettlement, but it's only less than 1% of the world's refugees that are ever resettled to a third country. So it's still a small chance. If you are found to be eligible and a country agrees to take you, it's not your choice as a refugee, it's the country, it's a country like the United States or like Germany who decides, yes, we'll take your case file. Then you'll go through screening checks, including health checks with that resettlement country. You'll have to go through the whole RSD process all over again to make sure you're really truly a refugee. And then finally, you'll be accepted and you would actually, board a flight and go to that third country and be resettled. So with the UNHCR and the IOM deciding they're just going to temporarily halt this process with no clear indication of when they would resume it, this really leaves the most vulnerable refugees around the world in a difficult situation. So many of them have made it through to this step number 7. They've gone through all the screening checks, including health checks, but those checks are only good for a certain period of time. So there's a chance that they'll expire. They'll have to be repeated if this process ever resumes. But it leaves the most vulnerable, and often they're considered the most vulnerable because they have existing medical conditions that can't be treated in that secondary country. So it leaves them in a really precarious situation. So beyond that, I think the real worry is that, once if this pandemic slows down and countries sort of reopen their borders, it will be really difficult to get this resettlement system up and running again. And it's a system that was already basically under threat anyway. Countries like the United States, which had previously been the country accepting the most refugees through resettlement, has been sort of winding down its numbers in the past few years. So this is already a system that was having difficulties. And I think with this current just complete pause globally, it's going to be really hard to get it up and running again. And the longer that we wait to do that, the more difficult it will be. Okay. Another negative trend we're seeing, and I think one that has the potential to become a longer term trend, is this enhanced use of deportation or continued use of deportation and this lack of access to territory. So I'll give some examples to explain what I mean by that. This is one of the camps on one of the Greek islands, which is where asylum seekers arriving in Greece have been forced to stay since the 2015 European quote unquote crisis, whereby an increased number of asylum seekers and refugees were arriving in Greece hoping to travel into other countries in Europe. So Greece basically enacted this containment policy, forcing individuals to wait on these camps or to wait in these camps rather than travel onto the Greek mainland or onto other countries in Europe. So these have been in existence for 5 years. Now, in mid-March, Greece took some asylum seekers from this camp and transferred them to a detention facility on mainland Greece with the plans to then deport these individuals to Turkey. So these are individuals who still have their asylum claims pending, but Greece claimed that it was doing this because these individuals provided a risk or an enhanced risk of spreading the disease. So this containment policy is something that has brought a lot of shame to Greece and to Europe over the past several years. And it's something that they would like to end. They'd like to kind of just send everybody back to Turkey and have sought out all these different ways of doing that. But with the current pandemic, it sort of provides an extra cover for Greece and other countries to do the types of repressive policies, including deportation of asylum seekers, that it would maybe have more difficulty doing in other circumstances. And as part of this sort of standoff between Turkey and Greece from earlier in March, at the beginning of March, Greece has also just ended its registration of asylum seekers. So it's basically saying that if you arrive in Greece after March 1st, we're not even going to pretend to register you as an asylum seeker. We're just going to deport you either back to Turkey or to a country of origin. So again, this is something that might come under more scrutiny if we were in different circumstances. Here's another example I'm going to use, or a few examples from the United States. So one worrying trend in the United States is that, I said that refugee resettlement globally has been put on pause because of the concern over spreading the virus by having people travel between countries. But the US has not stopped its deportation of asylum seekers from the United States to countries in Central America. So various countries, including Guatemala, for example, said, look, we can't take deportations right now. This is a health risk to us because the US has the highest number of cases at the moment, right? But once these countries objected to continued deportations, the United States threatened to cut off foreign aid to these receiving countries. So deportations are something that probably should not be continuing at the present moment, especially from ICE facilities or the Immigration and Customs Enforcement facilities that house these individuals where there are known outbreaks of the coronavirus. This photo is from the border wall, the construction of the border wall at the US's southern border, specifically in Arizona. So even though construction in the rest of the United States has, for the most part, sort of been put on pause, construction is continuing on the border wall in Arizona, which puts, construction workers at risk because the Trump administration says that the wall will help protect the United States against the coronavirus, which epidemiologists have said is not the case. And also the United States actually has many more cases at the moment than any other countries, south of its border. So it's really sort of serving, again, the pandemic is really kind of serving as a front to carry out these policies that administrations, not just the Trump administration, but other administrations around the world want to carry out anyway, that are quite repressive and in other circumstances might be receiving more scrutiny. And I think that all of this would be less worrying if we weren't already talking about a system of asylum and a system of refugee protection that was so under attack even before the outbreak of the pandemic. So I won't get into it too much, but some examples that I've researched include the 2016 EU-Turkey deal, which is a photo of that deal being struck in 2016 on the left, and then also the European Union's deal with Libya to intercept migrant boats traveling towards Europe, towards Italy, and the funding of the Libyan Coast Guard to intercept those individuals and return them to Libya, where people are living in very, unsanitary conditions in detention centers in Libya, which one also could imagine would pose a real threat if there were to be an outbreak in one of these detention facilities. So these types of policies have all been challenging this right to asylum, this right of access to territory. And now I think the pandemic, we can worry that the pandemic will provide an even extra cover for governments to carry out these types of policies with less scrutiny than they would otherwise be receiving. So one more sort of long-term threat I'll talk about is this increase in nativism and fear that we're seeing on sort of a global scale. So it's interesting when you think about the fact that a pandemic is sort of this, textbook global problem that, it crosses borders. It doesn't care about borders. The virus will spread worldwide, as we've already seen it to. And so it really requires countries of the world to come together and to cooperate in order to prevent further outbreak and to minimize deaths globally. But one of the things that we're seeing, at least in the realm of migration, is rather than cooperation, this increased closure of borders worldwide and this turn to sort of nativism and xenophobia and fear. I thought this tweet from President Trump sort of encapsulated, this linkage between fear over this pandemic and fear of spread of the virus, and this justification for further bordering and further closure and further sort of turning inward, rather than this global cooperation that one would hope would be sort of the main response to this type of situation. So now I will go ahead and just talk briefly about some policy recommendations. One thing I think we can do immediately is, as soon as the borders are able to open and not let it sort of linger on, is to reinstate resettlement, so global refugee resettlement. So the further we let this continue of it being sort of temporarily on pause, the harder and harder it will be to sort of regain the inertia of the program and to get countries on board again. So I think as soon as borders are open, we need to talk about how we're going to get this program ramped up back to at least the levels it was at before. One change I would like to see is that instead of asylum seekers being turned away at borders, again, asylum seekers have the right, if they arrive on the territory of another state, to claim asylum. And then once their claim is assessed, okay, some individuals might be sent back to their countries of origin if they don't meet the sort of guidelines for refugee determination. But we need to at least assess those claims, right? So right now people are being turned away without having the right to due process of having their claims assessed. So it's not a choice between just turning people away or keeping them in detention facilities. We can quarantine asylum seekers in separate spaces to make sure that they are not exposed or carrying the virus. but we need to at least allow them to cross into the territory of a state so that they have protection. Similarly, asylum seekers who committed no crime, so coming across the border of another country and claiming asylum is not a crime. So some asylum seekers are in detention facilities in the US just because they came to the US irregularly. So those individuals can be released from detention facilities, just as we've seen worldwide, various governments sort of releasing, political prisoners or people who have not committed grave criminal violations from prisons because we don't want to further perpetuate the spread of this virus. So similarly, asylum seekers could be released from detention facilities, and we also need to halt deportations of people, especially from the United States, going to countries in Central America, because we don't want to see further spread of this virus, or we don't want to be the cause of it. And then we need to uphold the right to non-refoulement. So this again is the principle that individuals cannot be returned to their countries of origin if they face danger. So this is something that should always be upheld. But I think at this particular time, under this pandemic, there's a real risk that the right to non-refoulement will not be respected. So that needs to be maintained regardless of the current situation with the pandemic. And then there's two actions I want to talk about that can really be amplified. So these are already positive things that are happening that we can help further support. So the first is that refugees and migrants are taking measures to protect themselves. Even in the absence of sort of minimal service provision being provided to them, they're taking measures at the local level, at the community level to help each other, whether it's, the same kind of actions that we're seeing between neighbors in different cities in the United States are being taken by refugees and migrants living in not great conditions around the world. And even though we can't provide necessarily the same kind of NGO support, some of that financial assistance could be transferred directly to community groups who could then help to protect their community members. Lastly, whoops, where'd my last point go? Okay, so using technology to keep asylum and resettlement systems operational. So just as we're using, Zoom today to keep these kind of talks from the Baker Institute operational in this difficult time, we can use technology to do things like conduct interviews for refugee status determination or asylum, whether it's, in Europe or in other contexts of the global South. In the United States, so that when it does come time to open borders again, we can have sort of a next pool of resettlement of those who are eligible for resettlement ready to go. So we don't need to pause the entire system. We can use these creative means of technology to keep these processes ongoing. Okay, so I'll stop there, and I guess we'll open it up for Q&A.
Okay, great. We have a few questions here. I'll try to get to everybody's questions. Again, please send the questions via the Q&A button on the bottom of your screen. That way I can try to get through all of them. Let's start with, we have a question here that kind of relates to one of the first slides that you mentioned. One of our members says that while he lived in the Kingdom of Saudi Arabia, the exit visas were required, at least for registered expats, to leave the country. So that this doesn't seem to fit with what you said about people having the right to leave the country that they're in. So I guess Saudi Arabia doesn't fit into this model.
Yeah, it's true. I mean, so again, with the right to internal movement and the right to be able to leave your country of origin, these are according to the UN declaration, right? So there are, in theory, not necessarily always in practice. I mean, with the right to internal movement, we can think about certain restrictions that certain countries place on the right to relocate from one city to another. So China, for example, it's a more complicated process to move your registration from one city to another. So that doesn't quite fit the model of internal movement. And similarly, many countries, unfortunately, also deny some of their citizens from leaving, and foreigners too. But even their own citizens, it denies exit visas, especially if you're maybe like a politically contentious person, or it thinks that somehow allowing you to leave the country will pose some kind of problem or security threat. There are definitely situations where countries do not allow their citizens to leave. And again, this is what the UN declares is sort of the norm or the right, is not always what's followed in practice. Good question.
We'll stay in the Middle East for a little bit. Could you talk a little bit more about the acute threat facing refugees in Syria, especially while the Syrian conflict is ongoing in places like Idlib?
Yeah, I mean, it's definitely a worrying situation. I think a lot of people are keeping their eyes on. At the moment, there's a ceasefire that seems to be holding, but there's no guarantee that it will. And the problem I think that makes Idlib particularly worrisome is that, I mean, there's a few different aspects to it. So one is that so many refugees or internally displaced peoples have accumulated in Idlib from all over Syria, right, over the number of years of the conflict. So there's more than almost a million internally displaced people just in Idlib province alone. And many of them, as we saw in that photo, are in these sort of overcrowded camp-like situations. Others are just sort of, in small towns and cities. But the whole region faces the fact that it's been under bombardment by the Syrian government and Russian air forces for many months at this point. And many of the medical facilities in particular were destroyed. So even though the Syrian government says that it's distributing some test kits and some other sorts of medical supplies to Idlib, it's not going to meet the needs if there is a major outbreak of everyone living there. So I think it's a real concern in that regard. And Turkey's not going to open its borders at any point soon, right? So people are more or less trapped in this confined zone. And if fighting were to resume, that would be worrisome on one hand. And if the virus or if there were to be a major outbreak of the virus, that would also be very worrisome. And it might go undetected for a long time because, as far as I understand, the testing available is just so minimal. So there might already be many cases that are contracted and spreading, and it's just not being recorded or observed. So the other concern is that there's, as we talked about, one of the immediate threats facing Idlib and other regions of the world is that there's a real minimal access that humanitarian workers have to get supplies and also people into the region. So international organizations and the UN are able to get some supplies, as far as I understand, but there's been a lot of delays in terms of people being able to get access to the internally displaced peoples that are residing there. And I don't see that changing anytime soon.
Very unfortunate.
It's a grave situation, yeah.
Okay, can you talk a little bit about how this situation, what's going on, will further complicate EU's relations with Turkey?
Sure. It's interesting. Just before the sort of Italy was already sort of a major hotspot, I think, when this occurred, but it hadn't really sort of reached the rest of Europe, and it hadn't really reached Turkey when Turkey and the EU had this sort of standoff. So basically, at the end of February, Turkey had led this incursion into northern Syria, and Turkish soldiers have been killed, probably by Russian airstrikes. So Turkey wanted the EU, as one of its NATO allies, to help respond and to help sort of enforce a ceasefire in northern Syria. When the EU and also the US kind of just gave Turkey lip service and were unwilling to do anything sort of more actionable, Turkey decided to encourage some of the migrants and asylum seekers in Turkey to travel onwards to Europe. So Turkey and the EU have had this relationship, as I sort of alluded to in one of the slides, as a result of the EU-Turkey deal since 2016. So there's this agreement in place whereby Turkey agrees to basically prevent irregular migration from Turkey to the European Union. And in exchange for that, Turkey gets paid, up to 6 billion euros was the original agreement. Not all of that money has come to fruition. And Turkey and EU's relationship has sort of deteriorated since maybe that high point in 2016. So the EU was also supposed to allow Turkey to revive these accession negotiations and was supposed to develop a customs union and other sort of various things that were promised to Turkey that also just haven't come to fruition. So the relationship has already been tense. And then when the EU wasn't willing to assist on this Syria issue, Turkey allowed, kind of broke this deal and allowed migrants to continue onwards towards Turkey, or sorry, towards the European Union, both by the sea crossing as well as by this land border. And basically, migrants and asylum seekers were just being used as pawns. They ended up sort of trapped in this land space between Greece and Turkey. I guess, according to Turkish officials, they were being shot at by Greek guards. So it was quite a dire situation. And Turkey not just sort of let people go, but was actually physically busing migrants from detention centers in Istanbul to the border. So it was quite a coercive tactic that more or less Turkey. It wasn't clear at the time how things were going to go, but and this is just as the pandemic is really breaking out across not just in Italy but across Europe. So this big meeting that was supposed to happen between European heads of state and Turkey ended up becoming this teleconference call. And basically Erdogan was promised that the EU is still on his side. They're going to offer more money for Turkey to continue hosting Syrian refugees and other asylum seekers and migrant groups. The issue of Syria was not sort of, was kind of put on the back burner, but for the most part, Turkey kind of got what they wanted. So I think the relationship is continuing. I think all countries are, Turkey is facing a much more serious outbreak of coronavirus now than it was at that point. So now there's a real threat that it's spread quite widely in Turkey, but they do have a lot of institutional capacity to handle it more than some other countries in the Middle East, North Africa region. But so for the moment, the sort of, uncomfortable relationship between Turkey and the European Union continues on, and we'll see how the particular migration relations will continue after this pandemic.
You also mentioned that countries were potentially decreasing their contributions to organizations like UN and also, as well as other NGOs that would work in areas such as this. For organizations like that, what kind of factors would you consider appropriate, like for them to appropriate their funds towards, considering that their funds are so limited now? What would you suggest they, focus on?
I think that it's going to be hard for them to do much more than sort of basic assistance, which is a lot of what they do anyway. And I should say, I don't know what the budgets look like now. This is sort of projecting into the future based on the fact that so many countries around the world are going to be facing tight budget restraints. We've already seen, this was more political and less to do with the actual substantive topic, but we've seen the US now pulling out its funding of the WHO, right? So you can imagine there's going to be other justifications like that going forward in terms of decreasing funding towards some of these international organizations. But I think that one thing I would say is that, so I think international assistance in regards particularly to refugees has increasingly since the Syrian crisis been focused not just on supporting refugees, but on supporting host country nationals. So this is, I think there's sort of two sides to this. There's one side that would say, well, this is positive because it prevents things like resentment. If there's a program going, let's say in Lebanon, there's this, certain Syrian refugees residing in a small village are being offered sort of food and financial assistance. Maybe poor Lebanese also living in that area are going to become resentful of why are these non-nationals getting additional funding when we're struggling as well, right? So the idea is that it helps present that kind of backlash against refugees. But the problem is that governments can sort of use this incentive to sort of divert funds or to, blackmail other countries in a sense about, in order to get increased funding. So in Lebanon, for example, I found a really interesting, when I was doing some research there a couple of years ago, a really interesting phenomenon was that Lebanon is sort of very hesitant to allow for the permanent settlement of Syrian refugees. And this is part to do with the fact that it has a very large historical presence of Palestinian refugees who have been there for many decades. So it doesn't want to allow for the same sort of semi-permanent settlement of Syrians as it did for Palestinians. So it's very against any kind of policies that will look like integration. So there are these sort of informal tented settlements of Syrians residing in the Bekaa Valley, which is sort of from Beirut, you have to kind of go up and over these mountains in order to get to this area that's closer to Syria, where a lot of Syrian refugees are living. And the UN is forced to truck, food supplies, sanitation equipment, water, all sorts of things up and over these mountains, and to deliver them to the people living in informal tented settlements there, because the Lebanese government is so hesitant about letting these Syrian refugees living in the area hook up to just local sewer lines or water lines or what have you. And so it doesn't really make sense from a donor perspective, because donors are like, well, why is there this extra cost of having to transport water for 4 hours when we could just hook up to these local infrastructure lines? And the Lebanese government, which has a lot of say now because the UN and donor countries are so desperate not to have Syrian refugees continue their migration onwards to North American or European countries, that they're willing to go along with this kind of program and not put pressure on the Lebanese government to just let refugees sort of somewhat integrate locally in order to save everyone, kind of the hassle or the money. So I think there are ways that refugee assistance could be delivered a bit more sort of pragmatically, and it would require some compromises on the part of host governments that at this unfortunately difficult time, politically, and now with the virus, refugees are sort of the last things on a lot of host governments' mind. But I think that there are ways that we could rethink some of the aid models to make them a bit more sustainable, considering that we're going to be facing some really, difficult financial shortfalls going forward. That was a very long-winded explanation. I hope that whoever asked that question feels satisfied.
Okay, we have some great questions here. Unfortunately, we're very limited on time. So I want to bring it back, kind of bring it to the United States. You mentioned one that there's one of our members asks, what is the current process for asylum review? And under your policy recommendation of releasing asylum seekers, how do you ensure that asylum seekers respond, for their reviews, etc.?
Mm-hmm. So the process has changed under the current administration. I think that was, a big concern, was that, well, if we let people sort of not reside in these detention facilities and we let them instead reside with their family members or at home, that they're not going to come back in for their asylum appointments. They're just going to disappear, become, migrants, irregular migrants, and then we won't hear from them again. There's been a lot of research into this by academic researchers, but also refugee rights sort of think tanks and organizations. And it's an extremely high number of asylum seekers that come back for their appointments. So it's something like 90%. You shouldn't quote me on that. I can look up the exact number if anyone wants to email me, but it is extremely high. Most people do come back for their appointments. So it's this sort of fallacy to think that, well, if we release them, they're just going to disappear into the interior of the United States and we'll never see them again. So I would say that the current system whereby everybody is detained is really not sustainable. I mean, it's financially expensive. It poses a current risk. It poses a risk under the current situation with the virus. Why have more people in these overcrowded situations where they can't socially distance, where there isn't enough sanitation or health services being provided, and it financially puts a strain on us as well, on the United States taxpayer, to keep them in these detention facilities. So why do this when we can allow them to go be with family members where they can socially isolate or do what needs to be taken care of at home and then return for their appointments? I think that, in my opinion, that is just a better system. It makes more sense, especially during this current pandemic.
Okay, and unfortunately, like I said, we have a lot of questions, but we're limited on time. So I'm going to close off with a question about Houston. And is it okay if our members email you with additional questions?
Sure, absolutely.
Great. So one of our members asks, how do you think COVID-19 is affecting refugees already in the US, especially in major resettlement cities like Houston?
Sure. I mean, I think in some ways we seem to be faring better than other cities as far as Houston is concerned. And I think this, people have speculated this has a lot to do with sort of the low density. We're not like New York or Chicago or other cities that are just higher density where people are going to have more and more interactions. So in that sense, whether you're a citizen or an asylum seeker or anyone else living in Houston, I think that so far, and this remains to be seen, the sort of infrastructure of our city makes it easier in some ways to sort of limit social interaction and the spread of the virus. But I do know that even before this pandemic, asylum seekers and refugees were struggling in Houston because of a lot of the funding cuts that have come to refugee service providing organizations in Houston. So we used to have, we were one of the highest recipients of resettled refugees in the U.S. And with the federal cuts to the refugee resettlement program, so we're taking in fewer and fewer people each year. That also means less funding for some of the service providing organizations in Texas and in Houston specifically. So the fact that those organizations can't sort of provide the same level of service, and then now during the pandemic, they're probably facing even more difficult sort of financial questions, I think puts a lot of families at risk, especially sort of newer arrivals who, don't necessarily know the city or the city's organization and which kind of organizations they could turn to for support. I think in this particular time, it's going to be really difficult for those families. But I do know, many of the service organizations here in Houston have been doing a lot to sort of fundraise and to try and help refugee families that are probably facing a really difficult time at the moment.
Okay, Dr. Norman, thank you so much for your talk. For our audience, on your chat box, you should see Dr. Norman's email address. If I didn't get a chance to get to your questions, please feel free to send her an image and a question. Thank you so much.
Thank you.